My name is Charlotte Bird and I'm the Active Ageing Officer at Heart Sport and Physical Activity Partnership. And today we're joined by Heather White from Study Active. And you might have seen Heather at our previous Masterclass webinar we did a few months ago, all about strategies to motivate inactive older adults. But today we're here to focus on osteoporosis and physical activity. So I'm really pleased to have Heather again, and Study Active crew have worked really hard with this webinar, and there's loads of useful information. So we will be doing some polls as well during this webinar, but it's Heather and I's first time actually doing polls, so hopefully they'll go smoothly. They're all set up, but we'll just have to see. So you are in a webinar today, and that means that you're muted and your cameras are off throughout the whole time. And we recommend selecting a speaker view for the best viewing experience. So you can do that in the top right-hand corner of your screen. Now, there is a chat function, and we welcome all comments, hellos, introductions. It's really nice to know who's in the room. And also, I find that a lot of really useful information comes from the people who are already on the call, and you share wonderful activities that you guys are doing. So put it all in the chat and make sure when you send a message that you send it to everyone. Often it's first instinct is to send it just to myself and Heather. So if you select everyone, then we can all see your comments. I am recording the webinar, and we will upload this to our website, the Live Longer Better in Hertfordshire website, and Study Active will have it on their YouTube channel, but I'll also send a link to everyone who has signed up to the webinar, so you'll all get a recording. We also will have a feedback survey that will pop up when you leave the webinar. There's 6 questions on that. So if you could just take a minute to fill those in, we'd be most appreciative, and it'll help us make sure that future webinars are as helpful as they can be. But without further ado, I'm really pleased to invite Heather to talk to you today about awareness of working with clients with osteoporosis.
Hi everybody, so I'm just going to share my screen. Just give me a moment to find what I'm looking for. All right, lovely. So yes, so hello, welcome. My name's Heather Walker. I'm Assistant Fitness Education Manager for Study Active, and I kind of am the older adults expert, if you want to call me that. About Study Active, just quickly, we are one of the largest UK providers of online fitness education, and we did recently win the UK Active Education Provider of the Year at the UK Active Awards, so it's quite a big deal. So before we start today, just a quick disclaimer really. So the aim of this webinar is to raise awareness of working with clients with osteoporosis, but it doesn't provide you with any sort of qualification. It is good practice to have a suitable qualification when you are working with clients with osteoporosis, and there are kind of numerous ways that you can kind of do this, and there's numerous qualifications out there. But if you are in doubt, then do contact a professional body for advice. If you are having any clients with osteoporosis come to you, they should consult a GP before starting any exercise program, and then you should make sure that you are following any advice from their GP and you're like factoring that in. So today's webinar, what it's going to cover, we're going to look at what osteoporosis is, what causes osteoporosis, and we're going to have a look at the prevalence as well. We're going to briefly cover the barriers both to being diagnosed with osteoporosis and barriers people might face when looking to do exercise. And then we're going to cover lots of exercise-based guidance. So what is osteoporosis? I'm just going to move my little box over here so I can see. So osteoporosis is a condition of the skeleton. It's characterized by a loss of bone mass and bone mineral density. This means that the bones become more fragile and then more susceptible to fracture. So with bone, generally throughout your entire life, bone is constantly being replaced. It's being sort of broken down and then rebuilt up. When you've got osteoporosis, you're basically losing more bone than is being built. So the processes involved become less regular. So the breakdown kind of happens more and the build-up happens less. This causes bones to become more brittle and they become weaker, and this is what kind of makes them more susceptible to this fracture. It can develop over several years, and you could go several years without knowing that you've got osteoporosis because there's no signs and symptoms. The first sign is usually when you go and break a bone. It can also cause a loss of height and a stooped posture. This is because the vertebrae in your spine, all those little bones, they become weak, they start to compress, they crumble a little bit, and it just causes the body to sort of stoop over. So that can also be the other kind of key indicator that someone's got osteoporosis. It can't be reversed, and it is also most common in postmenopausal females. So with osteoporosis, where this bone's being sort of broken down and it's not being built up as much, it can cause these more of like a honeycomb structure in the bone matrix. So you can see here, you've got your normal bone, kind of how it looks there. There's like smaller holes, they're not as large. And then over here, you've got your osteoporotic bone, where those holes in that bone, they're bigger. This is obviously where the bones are losing their density. So what causes osteoporosis? Age. Age is one of the biggest factors. As we age, our estrogen levels decline, and this causes osteoclasts, so they're the cells that break down the bone and clear the bone away, causes an increase in their activity levels. And then the osteoblasts, which are the cells that build up the bone, their kind of activity is inhibited. So the osteoclasts that are taking, like, reabsorbing that bone and breaking it down, they're more active than the ones that are building it up, which is obviously going to cause your loss of bone tissue. This is more common with women in the first few years after the menopause, because their estrogen levels are dropping. So that large decrease in estrogen, they lose that sort of protective effect, and that then causes all of the cells to break down and not build up as much. Lack of vitamin B and calcium. So calcium, hopefully everyone is aware, calcium helps make your bones stronger. It helps with building your bones. So if someone is not consuming enough calcium, this will have that similar effect. The bones won't be building up as well. And lack of vitamin D. So vitamin D is the vitamin that you get from the direct contact of sunlight on the skin. So if you've not got enough vitamin D going into your body, this makes it more difficult for the body to absorb calcium from the bloodstream, because that's one of vitamin D's main jobs. Use of steroids. So if you've got a client who's had a lot of corticosteroids due to medical conditions or whatever, this will inhibit the replenishment of the osteoblasts, and it's going to reduce that calcium being absorbed as well. And then I've just put some others on there as well. So certain medical conditions, and it could just be the medical condition or the medication used to treat the condition. Heavy smoking and drinking. If you've got a history of eating disorders or a low body mass index, these again can all kind of contribute towards osteoporosis. And then not exercising regularly. So I've got a separate slide on that. Sedentary behaviour and bone mineral density. Research has suggested that being inactive promotes the activity of osteoclasts, so those cells that clear away the bone, and this causes your loss in bone density. And there's several studies that have shown that there's a negative correlation between sedentary behaviour and bone mineral density, especially in women. So by that we mean the more inactive you are, the less your bone mineral density is going to be. We will discuss later how being physically active can actually help improve bone strength. So if you're being sedentary, you're basically not allowing those processes to occur, which again will kind of contribute towards osteoporosis. I've put the name of the study down here, so if anybody wants to go and have a look at that, if you just sort of Google the frequency of osteogenic activities, then you can go and read it for yourself. But there are other studies out there you can go and look at. Okay, so then we come to osteopenia. So this is the stage before osteoporosis. So bone mineral density is measured in in a way, and when it drops below -1 and -2.5, this is osteopenia. When it drops below -2.5, this is when it's then kind of classed as osteoporosis. So it's just a measurement of your bone mineral density. Not everyone who has osteopenia will then develop osteoporosis. There are preventative measures you can take, which we'll kind of come on to, that will sort of help prevent it from developing further. But yeah, so there's like a separate stage sort of osteopenia in the middle before you get full-blown osteoporosis. So quickly here, what should you do if you suspect someone has osteoporosis? Well, it's not our job to diagnose. Even if you've got one of the relevant qualifications, you're still not a doctor. You can't like diagnose someone. So if you do suspect someone's got osteoporosis, you will need to refer them to their GP, and then their GP can do the relevant assessments and confirm a diagnosis. Common fracture sites. So as I've said, fractures, broken bones are usually the first sign that someone's got osteoporosis, and you could break any bone in your body. It doesn't have to be one of these, but the most common ones are the wrists, the hips, and the spine. So wrists, commonly when people fall over, they'll put their hands out and they'll fall onto them, and that kind of impact will then cause that fracture in the wrist. Hips, again, commonly when people fall over, they'll kind of hit a hip, they'll sort of twist funny, they'll knock it somehow. So the hips are a common one as well. And then the spine. So the spine, this could be any sort of twisting movement or flexion or extension. And, you know, someone, if they've got severe osteoporosis, then even just a small sort of movement will cause this kind of fracture to their spine, to one of their vertebrae. Okay, so it's poll time. So this is where Charlotte and I are going to cross our fingers that everything works. So going to discuss the prevalence. So in 2019, over 3 million people in the UK had osteoporosis, with more than 500,000 receiving hospital treatment for bone fractures, which is caused by osteoporosis each year. So how much do we reckon treating fragility fractures is estimated to cost the NHS per year? Ooh, polls appeared. So if everyone wants to go and select an answer.
Okay, so as I did say, this is the first time we've actually done a poll, and I've got no idea if you can see the answers. Are they coming up, Heather? What people are...
Yes, the answers are coming up, and I can see how many people have sort of clicked each one.
Marvelous. That's what we want. Perfect. Okay, it's a good answers here. We've got 70% of people have answered so far, and it looks like 4.6 million is the best guess. And then for the second question, 1.1 million. This is really interesting. Heather, I'll leave it to you to, I'm going to end the poll in 3, 2, 1. Okay, Heather, you can blow our minds.
Don't know how to make it go away. Let's press that. So fragility fractures, 4.6 billion. So I know the most popular answer is 4.6 million. It's actually 4.6 billion. Okay, so in the next question, approximately 69,000 hip fractures occur each year, costing around how much? I don't know if you can bring the poll back.
I'm not sure if I can either. Let me share the results, because lots of people answered this one, and 75% people said 1.1 million.
There it is.
And you could probably guess from the first answer that we've given you now, it is in fact 1.1 billion pounds a year.
Yeah,
that is just on hip fractures alone, which is absolutely mind-boggling, which is why this webinar is so important.
Yeah, so with the hip fractures, it's obviously not just the cost of treating the fracture itself, it's then obviously the bed days, the amount of time that people are going to have to spend in hospital. You know, it's usually older people that get these fractures, so you know, they don't always have necessarily the best sort of support at home, so they sometimes end up staying in hospital even longer. But yeah, so it's also the bed days that kind of help add up to that staggering figure there. But just in general with osteoporosis worldwide, roughly 1 in 3 women and 1 in 5 men over the age of 50 will suffer with osteoporosis. So very large amount. Okay, so we're now briefly just going to discuss some barriers. So we've got both barriers to diagnosis and to exercise. So with diagnosis, a lot of time, especially spinal fractures, they'll be caused by low impact trauma. And people might just be like, oh, I've just got a bit of pain in my back. They don't necessarily think much of it. They think, oh, I just tweaked it a little bit, it'll be better in a few days. And then, you know, a few weeks later, it's still there niggling away. So sometimes people just don't even kind of consider the impact to be sufficient for it to necessarily be a fracture. So that kind of puts people off going to their GP, because they don't want to be a pain. They don't want to be like wasting NHS resources and time over just a little bit of lower back pain. The other problem we then sometimes face is if people do go to the GP and say, oh, I've got this lower back pain, GP just writes it off as wear and tear. They don't necessarily do the full investigations that they should to kind of figure out what is actually going on. It should be kind of anyone over the age of 50 that goes to you with kind of lower back pain. I personally think you should probably sort of send them off and be like, let's do a DEXA scan, which is how you diagnose osteoporosis and bone mineral density. But you know, it just doesn't always happen that way. With regards to exercise, so someone who has osteoporosis, they've got that diagnosis, they are aware of kind of what this means for them. They are aware that they've got low bone mineral density and they're more susceptible to fractures. So they're going to be more fearful when it comes to exercise, because they're going to have this fear of injury. They might think that, you know, by doing various activities, that's going to cause too much impact on them, and that's going to cause them to break a bone, that's going to cause that sort of fracture to happen. And also with exercise, and well, not just exercise, but life generally, they've got a fear of falling. And with exercise, sometimes it can be a bit unstable, especially if you don't know what you're doing and you're just sort of like maybe following along, or you're with someone who maybe isn't aware of the risks of osteoporosis. So, you know, they've got this fear of falling because, as we showed earlier on our common fractures slide, if they fall over, they're possibly going to fracture their wrist or their hip, or any other bone. But, you know, so they're going to have this fear of falling. So they might be quite reluctant to go and do physical activity because they're going to be scared of falling over. They're going to be scared of getting injured. So with fear of falling, like I just said, you know, they're going to be scared of falling over because they know that impact can cause these fractures. But this is true for not just exercise, but for everyday life. So, you know, there are some instances where people might just be too scared to leave the house or go out or do anything, because they might be like, oh, what if I trip over the curb or something on my way to the shops? So it can kind of cause that sort of negative impact, like negative thoughts of going outside. So they might become a bit more isolated. Not the discussion of today's webinar, but just something to be aware of. You know, we need to consider how we can kind of bring exercise into their inside life, and how we can kind of help support them through like getting over their fear of falling. So exercise guidance. Unfortunately, exercise for osteoporosis is more effective as a preventative measure rather than a cure. Although exercise can help improve bone mineral density, it's much better to be kind of doing it before you get to the stage of osteoporosis. So, you know, if you're physically active throughout your entire life, if you're doing the recommended exercise, you're going to improve your bone mineral density, which reduces your risk as you get older. However, you know, exercise can be used to help preserve bone mineral density, and we can do this with weight-bearing exercises. So this is things like walking, stair climbing, running. There's a caveat on that I will come back to in a next slide or two. Resistance training, so any sort of like weightlifting. This is going to help increase strength. And then muscular strength, coordination and balance training. This is going to help reduce the likelihood of falls. So where we've talked about how fear of falling is a barrier, if we're doing exercise that's going to help kind of improve our balance and reduce the risk of falling, this is going to be beneficial to our osteoporotic people. So how can exercise help? Exercise can help build and maintain bone density. Weight-bearing exercise appears to stimulate bone formation and the retention of calcium. So weight-bearing exercises with impact, this is also known as impact loading, can be beneficial. With these, the exercises are working against gravity to create compression or impact through the joints. So this is things like walking, maybe jogging and jumping. Big caveat on those: if someone has very severe osteoporosis, that would be too high impact for them. But if someone's kind of like in the osteopenia stage, or, you know, very, very mild osteoporosis, then potentially a light jog or gentle jumping would be okay, because it's giving that kind of impact and that compression through the joints. And there's evidence to suggest that that's going to help build and maintain bone density. However, the Royal Osteoporosis Society recommends that if you have had fractures or you often break bones, then you should stick with low impact exercises. So that is literally just things like walking, marching, and so on and so forth. And then with resistance training, so the force of muscle pulling against the bone stimulates the bone building process. So any exercise that places a force on the bone will strengthen the bone. So any sort of like resistance training exercise, if you imagine you've got some free weights and you're maybe doing like a shoulder press, as you're extending, the muscle in your arm is going to be pulling against the bone, and that's going to stimulate that bone building, that bone kind of density increase. Free weights are the best, but you can use resistance bands as a really great way of starting, because they can be a lot less intense, and they can be a lot less intimidating. A lot of people, if you say, right, we're going to do some free weights, they have all these pictures in their heads of like big heavy barbells and whatnot. So, you know, you can use resistance bands to sort of start off and be like, right, here's a nice gentle introduction, and then you can kind of gradually progress to like maybe some kettlebells or light dumbbells. You want to be conducting full body workouts because you want to target all muscle groups and bones, but especially those around the common fracture sites, so the wrists, the spine, the hips, but obviously any bone could be susceptible to these fractures, so you want to be getting a good full body workout in, so that we're then sort of helping the whole body. Okay, we've got another poll. So exercise guidance. People with osteoporosis, just going to go slightly, should meet the CMO's physical activity guidance of so many minutes of activity per week. However, depending on the severity of their condition, this might not be possible, so the intensity of exercise should be adapted. So what do we think? This is per week. What do we think the exercise guidance is?
Thank you, Heather. Sorry, I think I jumped the gun and put it up too soon.
No, that's fine.
Your screen. We've got 65% of people have answered. 75% of people have answered. We'll give it 4 more seconds. 3, 2, 1. That's 90% of people have answered.
Okay, lovely. So yeah, so the correct answer is 150 minutes of moderate intensity activity per week. I can see a couple of you have put 75 minutes of vigorous intensity activity. You are correct in that the CMO recommends either 150 minutes of moderate intensity or 75 minutes of vigorous intensity. However, if you've got osteoporosis, then I imagine vigorous activity isn't going to be suitable for you. So I can see why you've gone for that, but yeah, that would be too intense for our osteoporotic people. And then, yeah, you can see 150 minutes of moderate activity. So exercise guidance. So this has come from the Canadian Institute of Health Research 2016 and Becker et al. 2017. So generally they're recommending for aerobic exercise, you want to be doing 30 to 60 minutes of moderate intensity 3 to 6 times per week. And this, for example, could be walking, dancing, or an activity of daily living, so things that you're doing in your own life anyways, things like pushing a lawnmower. Resistance training, they're looking at maybe 2 to 3 sets of 8 to 12 reps, covering each of the major muscle groups. And we're looking at doing this at least twice per week. And then our examples, so lifting weights, obviously, but then our activities of daily living, things like carrying shopping or walking up and down the stairs, or, you know, people that are into gardening, any sort of like heavy digging and shoveling, digging up your garden to plant your rose bushes and whatnot. That would kind of count as resistance training. And then we're also looking at balance training. So about 30 minutes, 4 days per week. And we're starting on 10 seconds per exercise. And this can just be simple things like standing on one leg. Okay, so on to our exercise do's. So the key thing to remember is you've got to tailor it to your client. You've got to tailor it to their limits. And again, we're going to follow any advice that's come from like a GP or physiotherapist or other healthcare professional, because there's obviously varying scales of how severe osteoporosis can be. So, you know, if you've got someone who's severely osteoporotic, then you're going to be doing something completely different with them to someone who's kind of only just sort of crossing that border into, you know, that minus 2.5 bone density. So weight bearing exercise, we've already kind of talked about why that's important. Those compression forces are going to help stimulate that bone formation. And, you know, we've said weight bearing exercises, things like walking, maybe jogging, depending on the level. Again, if you've got your very severe osteoporotic client, they're maybe not going to be the best candidate to do jogging, but they can do some walking, some marching, maybe some gentle stamps. Excuse me. There is kind of discussions about like swimming and like use of cross trainers. These are both really great aerobic activities, but there isn't that weight bearing element to them. You imagine in swimming, you're kind of just floating, although you've got the water resistance, it's not weight bearing. Similarly with cross trainers, your feet are staying still, they're staying in contact with the cross trainer the whole time. So it's not technically classed as a weight bearing activity because you're not getting that sort of impact. Whereas you imagine if you're on a treadmill or you're just walking down the street, every time you put your foot on the floor, you've got that like impact. It might only be minimal, but that's kind of the difference there between like a cross trainer and a treadmill. Balance training. So anything that's going to safely help increase their balance. So you don't want to be doing anything like crazy. It can literally just be, let's see if we can stand on one leg. And you're going to do it in a very sort of controlled environment. So you can do it standing maybe against the wall or some sort of bar or something for support, so they can sort of, you know, gently rest their hands on that whilst they're lifting one leg, and then maybe kind of have their hands hovering, and then it's there to kind of catch them if they need to. But yeah, it's got to be in a controlled way that's not going to have too high a risk of falling. Because as we've discussed, they're going to have this fear of falling, and that's going to potentially cause fractures as well. So you want to think about ways that you can safely kind of increase their balance and help improve that. And you can start low, you know, like 10 seconds standing on one leg, and then gradually increase to like 15, 20 and so on. And then as they progress, you can kind of progress the difficulty. Things like TRXs, they can be quite good to kind of use as well, because you can kind of get them to maybe like stand on one leg and sort of move around a little bit, but they've got that TRX to sort of hold them up as well. So yeah, there's various different ways you can sort of think about incorporating various ways of support to help with this balance training. So strength training. So we've talked about how resistance training and that pull of the muscle against the bone can also help kind of with the bone building process. But if we're strength training and we're increasing like muscular strength, that's also going to help prevent falls because they've become stronger and they've gained that strength. So free weights, as I said, are good for like pulling the muscles on the bone. But if you want to use like resistance machines or other exercises, that's still going to help strengthen their muscles. So, you know, if you get them on like a leg extension or a leg press, although there's like less kind of compression and impact and all that, they're still going to be building that strength up in their legs. So it's going to help prevent the falls because they're stronger. Stabilization, especially the core. So again, the better your core stabilization, the better your body stabilization is, the more chance you've got of sort of counteracting any wobbles. So again, less chance of falling. And then we've got back strengthening exercises to help reduce kyphosis. So kyphosis, that's that stooped posture that we talked about, where they're kind of hunching forwards. So back strengthening exercises can help reduce that. But you want to be considerate of the back exercises you're doing. Things like a seated row or a lat pull down, anything that's going to engage the muscles is great. Things like dorsal extensions that lie on your front, lift yourself up. Not too much of a problem for, again, your mild clients, but flexion, spinal flexion, and extension can be, again, not great for someone if they do have osteoporosis. So I would maybe consider whether doing those sort of dorsal raises are the best of ideas. But yeah, any sort of, you know, back engaging exercise that doesn't put any spinal flexion or extension, absolutely a great idea. Exercises to avoid. So exercises with unstable base positions, because these are going to increase the risks of falling. So obviously we've talked about safe balance exercises, so that's fine, you know, as long as it's appropriate to the client's ability. But any sort of unstable base position, you just need to be careful, be cautious about. Get supervision or advice from a qualified practitioner if you're in doubt. But when I'm talking about exercises to avoid here, obviously not your balance exercises, but unstable base positions, are you going to get your osteoporotic client to do single leg squats on a Bosu ball? No, probably not a smart idea. Even things potentially like walking lunges or stepping out lunges, depending on the client, depending on their balance, might not be the best option, but it's always going to be kind of work with your client, start with the absolute minimum. So if you want to include lunges, then you can do them as a split stance lunge, see how they feel with that. If that's okay, maybe progress it to a step. But, you know, try where possible with any, especially like resistance-based exercises, try and keep that base position as wide and as stable as you can, because that's going to reduce your risk of falling over. Spinal twisting. So yeah, we've discussed how spinal fractures are quite common. So exercises like Russian twists, where you're sort of sitting and twisting side to side, that can cause issues, again, for your very serious osteoporosis. And then golf swings, so something people possibly wouldn't consider. I know a lot of older men like to go and play golf. They might have to consider that sort of twisting motion. Might not be the safest of options if they do have osteoporosis. Spinal flexion or extension. So again, I've talked about back exercise, back extension, so either the machine version or the bodyweight version. So, you know, although there are arguments that back extensions will help strengthen those back muscles, if you've got severe osteoporosis, you want to be avoiding that extension, because that could lead to spinal fractures. Also, sit-ups. I'm not a fan of sit-ups at the best of times, but definitely not with any sort of kind of osteoporosis client, because again, you're putting that flexion through that spine, which isn't great. And again, it could potentially cause fractures. Direct loading on the spine, for example, a barbell. So if you've got a barbell and you're going to do a back squat, that's direct loading on the spine. It sits kind of on the top of the back. Again, severe osteoporosis, that's going to put too much pressure on the vertebrae. It could cause the vertebrae to crumble. So again, not the safest of ideas. If you're looking at like incorporating squats, then you can do it as a goblet squat or a dumbbell squat, kind of holding one on each shoulder. But I would definitely avoid barbell back squats. High impact exercises. So any excessive impact could cause an impact fracture. So things like jumping, jogging, boxing. And again, it's going to depend on your client. So gentle jumping gives you that impact loading. If they're mild osteoporosis, might be okay. Everyone's different, might not. But certainly the more severe their osteoporosis gets, you definitely want to be avoiding all high impact exercises. So jumping, jogging, boxing. Boxing, I think, is actually recommended because it's difficult to impact load the upper body. But actually, if they've got osteoporosis, as soon as you start boxing, oh, there's your wrist fracture. So with all of these, like I say, it's very dependent on the person themselves, how severe it is. But always, 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 I would start with the bare minimum at the lowest, easiest level and gradually increase it, because it's much better to kind of start low and then be like, well, you know, it's fine, than for you to be like, oh, I'm sure it'll be fine if we start here, and then, oh, fracture, broken bone. So I would always, always, always advise starting low and then just gradually increase bit by bit. I've also added in here exercising on concrete floors. I don't know kind of what gyms are like these days, but I remember back when I used to do gymnastics, where it was a sports hall with a concrete floor. So sports halls always used to have concrete floors. If you've got an osteoporotic client and you're exercising on a concrete floor, even something as simple as just marching, because the concrete is so hard, that's too much impact, and that can then cause those fractures. So also always be aware of kind of your flooring as well. Kind of make sure you're using mats if you do have a concrete floor in your sports hall. And again, concrete floors, not that we are going to do sit-ups because they're bad, we've already decided that. But again, if you're lying on the floor and you've only got a very, very thin mat, and also consider the thickness of your mats. If you've got a very thin mat, as soon as they're sort of crunching up on the floor, their spine's then crunching into the concrete floor. Not good. But we're not going to do sit-ups anyways because we've decided they're bad, but just in case. So yeah, so also be aware of your concrete floors. I haven't put it on here, but obviously just other things to be aware of when you are working with these people. Trip hazards. There shouldn't ever be any trip hazards anyways, because anyone could fall over them, and that's, you know, not great. But especially with people who falling over is more likely to cause fractures, you know, do just kind of make sure you've risk assessed your room, you've checked for any sort of trip hazards. If there's anything lying on the floor that anyone could trip over, go and move it, go and put it away. You know, just obviously be aware of these things. So nutritional guidance, I've just thrown this in like very, very briefly. So eating a balanced diet can help keep bones healthy, but the most important nutrients being calcium. So we've already talked about how calcium kind of helps with bones. So it's going to keep the bones and the teeth healthy. Vitamin D helps absorb calcium from the bloodstream. And then protein is going to help with muscle repair and maintenance, but it's going to help with your bones as well, keeping them sort of protected. So yeah, so just a couple of nutritional points for you to kind of consider. So if someone does have osteoporosis, obviously if you're trying to give any sort of specialist nutritional advice, then they would need to see a dietitian, but you can just advise them, oh, make sure you're getting enough calcium, make sure you're getting enough vitamin D, make sure you're eating enough protein. Okay, so I've now got two slides on the Royal Osteoporosis Society. So I've put their website just there. They've got a lot of great resources. There's many, many things on there. So first of which, they've got this Dance for Your Bones. So I've got a little picture of it there. So she's teaching a dance that you can go and do if you've got osteoporosis. It gives you that weight bearing, little bit of impact, very sort of minimal sort of impact. So it gives you your aerobic workout. It's going to give you your weight bearing kind of workout. And it's just a bit of fun, really. So hopefully people will enjoy doing it. It's something that they could do at home. They don't have to kind of go anywhere special. You just need like a little bit of space in your living room. So it's something that, you know, people can have a go at. That like might just be fun and help them. And then they've still got lots of great resources. So here's another link to a different kind of page on their website. And this page, it's got lots of different sort of videos of different exercises, and they've got like options for each. So you can see here, he's doing like a dumbbell squat, she's doing it without, they're both doing it kind of onto a chair. There's lots and lots of different exercises on there, and they've kind of staged them all. There's another part of the website that talks about the impact loading and kind of different levels of impact. They've got like the low impact sort of starter, and then they talk about how you can then progress it and like advance those moves onto like moderate impact, and then how you can progress that a little bit further to more moderate impact. I can't remember their exact phrase, but yeah, there's lots and lots of great resources. So if you want to go and have a look, then go and have a look at the Royal Osteoporosis Society website. Got it there for you, www.theros.org.uk. There are lots of great things on there you can go and have a look at, and there's like the FAQ page, and so yeah, do go and check it out if you want more information. I've popped a couple of other useful resources on here. So got the NHS website, which kind of tells you what osteoporosis is. We've got the International Osteoporosis Foundation. So again, an international body that again will just tell you more about osteoporosis. And then another NHS link here for bone health and how to keep your bones strong over 65. Again, it talks about exercise, nutrition, all of that sort of thing. So yeah, you can go and check those out. So summary, yeah, so we're at the end basically. So we've discussed osteoporosis, we've discussed what it is. It's that low bone mineral density, it's where your bones become weak and brittle. We've talked about how it's caused, so predominantly aging, unfortunately, but other kind of factors such as steroids and being sedentary, smoking, drinking, low body mass index, lots of different ways that kind of it can be caused. And then we've talked about different like safe exercise guidance. So, you know, the general CMO guidelines for 150 minutes of moderate intensity activity. But again, tailor it to your person. They might not be able to do that much. They might not be able to do it all in one go. You might have to break it down, use a lower intensity. And then we've identified exercises that we should be considering. So our weight-bearing exercises, our resistance training, balance training, and exercises to avoid. So obviously we went through all of those: high impact, twisting, spinal flexion, spinal extension, unstable base positions, and concrete floors. Avoid the concrete floors. So quick reminder, obviously you need to have a suitable qualification. It's good practice if you do have a client with osteoporosis. Little bit of a plug here. Here at Study Active, we offer the Supporting Clients with Long-Term Conditions course, which will qualify you to work with these clients. So if you are interested, please let us know. It's something we can kind of discuss with you. So yeah, so we will do some Q&A, but before we do, if you would like to go and please subscribe to the Study Active YouTube channel. We've got lots of different fitness videos on there. We've got some of our webinars from so our previous webinar for HSPs on there. We've got some of our other webinars we've done for other companies, as well as kind of some like tutorial videos for various exercises. So please go and subscribe to our YouTube channel. So if we now do questions, if anyone's got any questions that they want to discuss.
Thank you, Heather. So there is one question in the Q&A box from Sandra, and this question was asked back when we had the exercise do's slide up, and it's, what is TRX? What does
TRX.
that mean?
Yeah, I don't know what it stands for, but it's like two sort of straps that have got a handle on them, and you sort of suspend them from something. You can suspend them over a door, but always be careful when you do that, because obviously the door can open. But it's basically like two straps that have got a handle on, that you can just sort of pull on, and you can adjust the height of where the handles are, so you can kind of have them up here, or you can like do some floor-based exercises with them. But yeah, it's basically like handles that you suspend
Equipment to use.
something.
Yeah, that's great. Thank you, Heather. And then in the chat, I've been keeping a note of some questions. So someone asked, and this is just directly to us, it was to do with a specific medication that they take and whether that would increase their risk of osteoporosis. Now, it was a nasal steroid. So given the fact that it is a steroid, steroids are shown to increase risk of osteoporosis because of the impact it can have on bone density. As Heather and I are medical professionals, though, probably worth a conversation with your GP, which if you've got concerns about that having a direct impact, because there are medications you can take to improve or retain bone density. Yeah. Would you add anything to that, Heather?
Not really. I mean, yeah, like you've said, if it's a steroid, then definitely I would go and have that conversation with your GP. You might find, because all medications come with that like piece of paper, don't they? They fold out and it's like a massive piece of paper.
Yes.
Somewhere on there it might tell you, FYI, you know, these are the side effects of this, or these are some of the contraindications or whatnot. So maybe have a look at the piece of paper that comes with the medication. But yeah, I'd maybe go and have a word with your GP and just speak to them about it.
Thank you. And Ruth asked, is there a need for more training for GPs to support with diagnostics and onward referrals? On this point, Ruth, something on the Royal Osteoporosis Society website is their State of the Nation report. And this is quite frankly quite mind-blowing. So as a result of that report, they've identified that 1 in 10 women over the age of 50 have an osteoporotic vertebral fracture, and that increases to 1 in 5 women over the age of 70 have an osteoporotic vertebral fracture. They are the most common fracture site. However, this is the really shocking part, is that 70% of them go undiagnosed. And a huge barrier to that, like Heather alluded to before, is it's normally at the GP level, a massive barrier. So there is a piece of work going on in terms of upskilling primary care on the prevalence of osteoporotic fractures. They found that they were often undiagnosed because it would be put down to wear and tear, like Heather said, and normal aging, normal back pain, and really a characteristic of vertebral fractures, osteoporotic ones, is that they come from non-traumatic events. So what I mean by that is it's not that someone's fallen off a ladder. It's not that someone's even fallen from standing height, but it's that maybe they've lifted a plant pot or they've moved something heavy. And I have had heard of a story where there was an elderly gentleman and he moved a plant pot in his garden, and that broke some of his vertebrae in his spine because he had very severe osteoporosis. So vertebral fractures are massively undiagnosed, and I can think back to when I supported older adults in the community, and there's one lady in particular who used to complain of back pain, and I was oblivious to this as well, and she'd been to the doctors and they'd said to her, oh, it's just normal wear and tear. She was saying, I can feel my spine has changed. So it's incredible to read that report. It's called the State of the Nation report, and definitely, yes, there is the need for more awareness with GPs and fractures. Now, Joe Smith has asked, is the course SIMSPA recognised? So, Heather,
yes,
I believe it is, isn't it?
Yeah.
And if you're interested, if anyone's interested, you can drop me an email and I'll get you in touch, or go directly to Heather, but I can always put you in touch with Study Active. It's a really good qualification and it covers an awful lot. It's quite it's been recently renovated, if you will. Recently had some new information added to it.
Yeah, it used to be exercise referral, and then they've kind of updated it and turned it into long-term conditions, or supporting clients with long-term conditions. But yeah, it covers covers lots and lots and lots of different conditions. So osteoporosis, osteoarthritis, rheumatoid arthritis, low back pain, total joint replacement, various cardiorespiratory, diabetes and metabolic conditions, and mental health conditions. Oh, and neurological ones as well. So yeah, lots and lots and lots and lots.
Yeah,
of course. So it's definitely a good one to do. And I'm not just saying that because I want you all to come and do it, but yeah, no, it's a good one to do because it does sort of help raise awareness for all the different conditions. And yeah, I just always think it's a good idea to know how to deal with people.
Thank you. Now, Liana has shared with us what TRX actually stands for, and it's not entirely obvious, to be honest, but it stands for Total Body Resistance TRX, which was that the 2-rope equipment that we were speaking about. And also we had another question come through from Jane, who was diagnosed with osteopenia a number of years ago and took Adcal, which is one of those calcium and osteoporosis preventing medications. So please forgive me if I've got that wrong, but and she had another bone density scan which showed that her bone density had improved and that she no longer needs to take the medication. But she's recently been told that this was nonsense, and all women over a certain age past the menopause, because that's when hormone changes happen, they should be taking calcium and the Adcal D3, and just suggesting that GPs board training on this subject. I don't know what the guidance is for Adcal D3 and whether that all women past menopause should be taking it. But it does seem that it is a very important subject that sometimes we need to take consideration for ourselves, and make sure that we are doing the best movement, the best exercise, the best nutrition, general well-being to support in that way. I don't know if there's anything you wanted to add to that, Heather.
Not really. I mean, again, I'm not a doctor. I'm not, any of that. I know bare minimum about medications and things. But yeah, I think anything you can kind of be doing yourself to sort of help your bone mineral density. So exercise, as we've discussed quite a lot, calcium, vitamin D, I mean, potentially some sort of like medicine that you've just said, but I think it would possibly be like a conversation with your GP or some sort of medical advisor for whether it's necessary.
We've had another medical question, which we don't know the answer to, but it's, do we need a GP referral to have a DEXA scan? Well, actually, Heather, you might know the answer to that, but I don't know the answer to that.
Yeah, so I suspect because you would go to your GP and they would then say, okay, I'm going to send you for a DEXA scan. Potentially you could maybe go and pay for one privately. I have no idea how much that would cost. I imagine quite a bit, but yeah, I think generally you would need to go and see your GP first to kind of get that DEXA scan.
And very quickly, Dion did ask if there was community provision. So I just have one slide to share with you all about community provision, community classes that happen across Hertfordshire that will hopefully be of interest. I've completely forgotten how to share my screen. Where's that button gone?
Zoom, and at the bottom there should be a button.
Oh yeah, the big green one that's
big green one, yeah.
Yeah, that one. Okay, so we do have strength and balance classes, and as Heather spoke about in detail, the benefits of strength and balance exercises do directly correlate with osteoporosis. These are funded by Heart, Sport and Physical Activity Partnership, and they take place in all 10 districts of Hertfordshire. So there's one in Hertford, Welwyn Garden City, Letchworth, St Albans, Borehamwood, Watford, Cheshunt, Stevenage, South Oxley, Hemel, and we do them on Zoom as well if they are not convenient. So I'll share these slides with everyone and links to find your local strength and balance class on movingmore.co.uk. And also something that is pioneering and a national first is that we have a judo and the art of safe falling program. And this is world renowned and cutting edge, and this is currently funded by the Healthy Hub in Welwyn and Hatfield. This is the only class of its kind in the whole of the country, and it happens at the Hart Sports Village, the University of Hatfield, on Monday afternoons. Now this uses the techniques of judo to reduce your risk of injury when you have a fall. It's absolutely ideal if someone's at more risk of injury when they have a fall, because they can learn how to fall more safely. and it's not that you will go along and Mike runs the classes, Mike Callan, he's not going to throw you over his shoulder and put you on the floor. It's good, they're baby steps, and it's that people are supported to learn the art of getting on the floor safely, getting up again, and also how the things you should consider if you were to have a fall, like breaking your fall. So I will also share information on that. But this is a one-off. It's something that we hope to expand, and I will throw it in there. I'm going to Japan on Thursday. I'm going with Mike, and we're going to the International Consensus Conference on Judo for Safer Falling. And our aim of that is to be able to come back and say, everyone should have access to this. And then maybe we could roll it out further, not just Hertfordshire, but nationally as well. So there's definitely ties with osteoporosis there. So if you're interested, I will share information, and you're welcome to email me back about that. I'm just checking the chat if there's any last minute questions. Forever Active is a charity running strength and balance classes in Cambridgeshire, Stephanie has shared, and there are some really good provisions across the country for different counties. So if you want connections to your county, if you're not from Herts, then I can help with that. And Diona said a private DEXA scan costs about £125. That's really helpful information. Thank you so much, Dion. And Di has said she's just had a second DEXA scan, and her osteopenia level is the same 3 years later, and she believes that could be due to exercise, as she's understood from today. Di is actually a Live Longer Better champion. She's absolutely amazing, and maybe, Di, that is from having Sir Muir Gray's books and using them as gospel. So Sir Muir Gray is the leader of Live Longer Better nationally, and he's got a couple of books, one called Sod 60 and one called Sod 70, and Di is an absolute advocate for that. So I'm really pleased to hear that, Di. I'm so pleased that today's been really helpful. Oh, another good last minute comment from Dion that HRT is bone protective, that's really useful to know. So thank you all so much for coming. I hope you found it useful. There is a survey, if you could fill it out afterwards, that just helped me and Heather know how to give you more helpful webinars. And our next Masterclass webinar is with the Alzheimer's Society on the 5th of December over lunchtime. So you could just pop on and have your sandwich at the same time. This is going to be about dementia friends and how sport and physical activity sessions can be more inclusive to people living with dementia. And the sun is doing something crazy. I look a bit like a ghost. So with that being said, if there's anything else you want to mention, Heather, before we say goodbye to everyone.
No, I don't think so. I think just thank you everyone for coming. It is obviously a very important topic to sort of raise awareness of. So it's great that you've all kind of come along today. So thank you.
Yeah. Thank you so much. And we'll share the link to the SIMSPA endorsed Study Active UK course as well in that email. And anything else, just let us know. But thank you so much for coming, and have a lovely rest of your week.